This is the first Rare Neuro-Immunologic Disorder Symposium that we have had here in Colorado. And so you are helping us to make history, and in return, I hope that we are able to help you answer any questions that you have and give you or help you to have a greater understanding of these very rare disorders. As you no doubt have experienced, when you are suffering, you or a loved one are suffering from something rare, by definition, that means there aren't a lot of people who really understand what that something might be. And so we are a team here of providers who do focus on these disorders and hope to be able to help you today. Now, we couldn't do this today without the Transverse Myelitis Association. The Transverse Myelitis Association is a nonprofit grassroots organization that was started by Sandy Siegel after his wife contracted transverse myelitis as an adult. And it really is a fantastic organization committed to education and helping to train other young doctors to know more about these rare neuroimmunologic disorders so that there hopefully eventually will not be such a paucity of neurologists in the country who are familiar with these disorders. So I give a warm thank you to the Transverse Myelitis Association for making this event happen. All right. I am Teri Schreiner, and I am a pediatric neurologist who subspecializes in neuroimmunology. And I'll talk in just a minute about what this field of neuroimmunology is. And I'm going to speak in very broad terms just to convey some general themes. I will discuss 2 of 4 different rare neuroimmunologic disorders. Dr. Bennett will address the other 2. And then we'll have an hour-long panel in which you will have the opportunity to ask a number of us with subspecialty in these disorders questions that have been on your mind and unanswered, or something that has been insufficiently answered for you in the past. We'll do our best to try and help you. If you have questions that are specific just to you that may not be generalizable to the group, I'll ask you to maybe just write those down and grab one of us later, because we're all here to learn from one another as well. Now, before I get started, I'd like to know a little bit about who is in the audience. And so I don't want to ask you to reveal anything that you are not comfortable revealing, but if you are open, I'd love to know how many people here have had an episode of transverse myelitis. Okay. All right. How about acute disseminated encephalomyelitis? Okay. And acute flaccid myelitis? All right. And what about neuromyelitis optica? Okay. And anything, any other rare neuroimmunologic disorder, anti-NMDA receptor encephalitis, autoimmune encephalitis? Okay. And how many people are caregivers? Great. Thank you for coming. How many people are from outside of Colorado? Wonderful. Thank you for making the trip. Anybody from east of the Mississippi? Great. Anybody from another country? Okay. All right. I see one in the past, but I know where you live. Okay. Let me address a couple of housekeeping issues. There is food outside. Hopefully you've seen that and grabbed some breakfast. We will have lunch provided as well. That is on the agenda, and there will be tables set up in an adjacent room where you can bring your lunch and sit. I encourage you to meet other people, learn from each other, discuss over lunch, and then we will get started back here at 1. There are several restrooms available. They are both to the left and to the right, and Alina is is gesturing. That's fantastic. Yeah, follow the lights, and yeah. Anyway, what else? We've adjusted the temperature down a little bit in here, so hopefully everybody will not be scorching. If you do find that it's too cool, let us know. There is a cafeteria nearby, just down in that direction. If you have particular dietary restrictions and don't find something for lunch, it is just right over there. And I think that is it for housekeeping. So, as I mentioned, I'll first go over sort of the overview of what a rare neuroimmunologic disorder is, and then discuss two of the four that we'll highlight today: acute disseminated encephalomyelitis, or ADEM, and then this question, new myelitis, acute flaccid myelitis. And I see there's nobody in the audience today who has acute flaccid myelitis, so we'll discuss that briefly. And then Dr. Bennett will come to the podium and discuss Neuromyelitis Optica Spectrum Disorder and the disorder that we call Transverse Myelitis. So I mentioned that I was going to start very broadly, thinking about what is a rare neuroimmunologic disorder. Well, the rare piece we understand pretty completely. The neuroimmunologic piece means really the two systems are coming together to create a disorder: the nervous system and the immune system. And what we have here is, on the left, the brain and the spinal cord, what we call the central nervous system. And then depicted on the right is more of a schematic of the peripheral nervous system. Now, within the field of neurology, there are some docs who prefer to think about peripheral nerves and those that prefer to think about central nervous system. I fall within that category, but truly, the nervous system is both, and it's functioning together to do everything that we want our nervous system to do, to move us, to feel sensation, to keep our movements coordinated, to give us vision, and of course, cognition. The structure of the nervous system is that of wires, basically, going back and forth. Within our brain, we have cell bodies that process information, and then there are wires that exit the brain, go down through the spinal cord into the rest of the body to help us do things like move our arms and legs. We also have fibers that run in the opposite direction. So just like a telephone wire, work with me on this analogy, you're sending information one way, but it's also coming back to you. Our nerves are kind of like that. They're wires going in both directions. And so the wires that convey sensory information from our limbs go back up through the spinal cord and get processed in the brain. So if there is a disorder, for example, an inflammation in the spinal cord that affects these wires, it's quite common to have problems not only with movement, because the pathway, the wires coming from your brain to your body are interrupted by the inflammation. It's also very common to have the reverse, sensory loss or worse, sensory pain, because the wires have been affected by the inflammation. In the brain, if we have inflammation, that interferes with connectivity. Because again, we have pathways throughout our brain going back and forth, not only just going down into the body and back up. So the immune system is very complex, and I like this schematic because it kind of it projects in a sort of lighthearted way what our immune system does and a couple of the different aspects thereof. But the ultimate goal, we think, and we all understand, is that we want our immune system to go out and destroy things that do not belong in our body. Viruses, bacteria, fungi, invaders, things that are trying to get into our body to create illness. We want our immune system to be able to effectively identify those things and then go out and destroy them. And there are a number of different mechanisms and different cells that help that to occur. However, when the immune system gets confused and attacks us instead of the invaders, we end up with this thing called a neuro-immunologic disorder. We end up with the immune system behaving badly. So there are some neuro-immunologic disorders that are relatively common. I think we all probably know someone or know someone who knows someone who has multiple sclerosis. This is a disease of the immune system that's relatively common. In the US alone, we have 400,000 or more patients with multiple sclerosis. But there are rare neuroimmunologic disorders that exist on a much smaller scale, and I've listed a couple of them there, and we'll discuss them further. These are disorders that are on the order of 0.2 people per 100,000. Very rare disorders where if you are diagnosed with this, you may not know anyone else with this disorder if it were not for this type of a forum in which you are able to meet them. So there are many different ways to categorize these rare neuroimmunologic disorders. You can categorize them based on mechanism. You can categorize them based on age of onset. You can categorize them based on whether or not they happen once. They're called monophasic, or whether or not they happen more than once. So we're going to go forward in sort of balancing these two categories, talking about the monophasic disorders and then a little bit more about Neuromyelitis Optica Spectrum. So first I'll talk about ADEM, Acute Disseminated Encephalomyelitis, or ADEM, for even shorter than ADEM. This is a disorder that is rare. Again, on the order, in at least a Canadian series, of about 0.2 patients per 100,000 people. It is a disorder in which there is central nervous system inflammation. That inflammation may be in the brain, it may be in the spinal cord, but the changes that we see in the patient are representative of where the inflammation is. And oftentimes it's extensive. I'm going to show you some pictures in a minute so you get a sense of how extensive it is. But this is something that oftentimes, or much more commonly, occurs in children than in adults, though I know we are joined by at least one adult today who has had this. It commonly occurs after illness, more rarely after vaccination. In about a quarter of patients, we don't know why it happens. We haven't identified that yet. The hallmark of acute disseminated encephalomyelitis is confusion, what we call its encephalopathy, a disorder of your mental status. For some people, that might be just sort of a mild confusion, not remembering things that you otherwise would remember. For some people, it's a florid psychosis, seeing things on the wall, like being irritable, agitated, or sleeping for 23 and a half hours a day. It's a marked departure from that patient's baseline mental status. Now, I've put up the diagnostic criteria here, but this basically echoes what I've mentioned, is that one of the hallmarks is the confusion, the encephalopathy that comes with the disorder. But there are also typical MRI findings, and as a neurologist, we rely heavily, more heavily sometimes than others, on MRI. It's a picture that helps us to understand what's going on within the central nervous system. And what you can see here on these images over here, this white part here in the middle, that's abnormal. That's a pretty swollen-looking bilateral central gray structure that is atypical. And then hopefully you can recognize down here this white area here. It's very extensive, it's asymmetric, it extends from the innermost part going to the outer, and there are also more subtle areas of signal change over here. These are some of the pictures that we see with ADEM. Now, an important caveat about this is it's a syndrome. We use the word syndrome to describe things that happen together in different patients, but it doesn't really tell us how. It doesn't tell us how this happens necessarily, and it doesn't tell us that everybody who has this syndrome is suffering the same thing. It just shows us that there is a constellation of symptoms that tend to occur. They look like this. We think they're all related. We hope that as we go forward, we're able to do a little bit better in definition of that. And here's some more pictures you can see. Again, this is a picture of a spinal cord. Between the two red arrows, you see that area of sort of lighter gray in the center of the spinal cord. That's the area of inflammation. And you can see it looks a little swollen. It is. And then over here on the right, we see other more widespread changes seen in ADEM. Now, generally, patients with ADEM recover well. That doesn't mean that they recover completely. What they might have is recovery over weeks of the weakness that has afflicted them, or the sensory troubles, the bowel and bladder troubles. But the prolonged symptoms, which tend to be a little bit more insidious, are the ADHD type symptoms, the difficulties in school, sometimes even personality changes. And then there is the possibility, particularly in children, that the first episode that we call ADEM might actually not be ADEM, a one-time event, but the first of a disease like multiple sclerosis that will continue. Now, I'll touch briefly on acute flaccid myelitis. You may have noticed earlier when I listed this on the slides, there's a little asterisk, and that is because this is a newly recognized disorder that may not, in fact, be immune-mediated. It might actually be a direct infection on the spinal cord. We're trying to figure that out. But the disorder is that, primarily in children, of acute onset of flaccid, meaning sort of floppy weakness in the limbs, or sometimes in the brainstem, that occurs commonly after an infection. And this was recognized and described first in California a couple of years ago. And then in 2014, we were really involved here at the Children's Hospital Colorado with describing a cluster of patients, 12 patients, who presented within this time frame, so almost exactly, or I guess exactly 2 years ago, with a respiratory illness that in some cases was mild and others was severe, and then a subsequent paralysis. When we recognized that this was happening, we contacted the CDC, and along with the CDC came up with a definition to make sure that what we were describing as AFM would be uniformly applied to others who might see this across the country. And one of the criteria was that when we saw inflammation in the spinal cord because of AFM, it was, for the most part, localized right here, these sort of anterior gray zones where the cell bodies of our motor nerves live. So this was a distinctive thing. This is different than what we usually see with transverse myelitis. And you can see on these MRIs, and the arrows help, there's sort of a stripe going up and down here on both images. That stripe shows the inflammation in that gray part, but from the side. And we had changes seen in the brainstem as well. All of that was happening at a time when there was a severe respiratory outbreak across the country with a virus called enterovirus D68. And so our suspicion is that these two things may be related. But what we see here is that this is something that we recognized here in Colorado as being a cluster, but it was really throughout the country and subsequently reported in countries around the world. And what we've seen as we've followed these patients is that there has been some recovery, but really there's been marked atrophy of muscle in the limbs most affected. So this is a pretty destructive process that has left the patients that we've seen with marked weakness. So whether or not this is a new entity, AFM, we don't really know. It's probably been around for a long time, but because there was such a profound and extensive infection with the enterovirus D68, that we might have seen more of this because of the number of patients involved with that respiratory sampling. So we are continuing to watch for it. Thankfully, last year we did not see many cases of AFM, but the CDC has reported in the first half of 2016 they've had 21 cases. And so I think it's still there and something that we'll continue to be vigilant watching for.